go to the space because we want to understand how aerospace protocols can be applied to manage the coronavirus emergency. And we have Ilaria with us. Can you hear us? Yes? Okay, so I think you have a presentation, right? You can share your presentation with us. First of all, you are a member of the Aerospace Medical Association. Where are you connected from?
Sono in Italia, quindi sono in
I'm
Italia con un figlio
in
e
Italy. I'm at home right now, of course, as all of you.
io ho la presentazione full schermo pieno. La vedete?
You have to click present.
Sì, ho cliccato.
Okay, we can see you and your presentation, and you can start.
Io e Ilaria Cinelli sono ingegneri
Good
biomedici,
morning. My
laboratori
name is
Aerospace
Ilaria Cinelli. I'm
sono
a
un membro del Consiglio di
medical
Presidenza
engineer and
e
I'm a
la
member of the
presentazione
Aerospace Medical
il
Association.
professor
The
Grace
work
Cook,
I would like to present you was carried
che
out in
insegna
collaboration
questo
with
tipo di
Thais Russomano,
ritiro
who
dell'Innovaspace.
is the CEO
Allora, qui
of
proponiamo
InnovaSpace.
software che può essere tutta l'innovazione dalla parte di medicina farmaceutica applicata sulle
Now,
epidemie.
I'm talking about
Se vedete il testo,
space
come sempre
medicine
molto
applied to
in
epidemics.
questa
We often look at aerospace as something far away from us, but this is not the case.
presentato tutti quelli che
Um,
parlavano di innovazione, di tecnologia
we
medicinale
think that when it comes to
sono state
technologies or
difficili e
aerospace, this is
molto
something
complesse per
that
essere
does
poi
not or cannot be
applicate
applied to us. But we have to look at how it is possible to do that.
di come magari
So
medicina spumante
I would like to share with you this piece of information, which means that how space medicine can be applied to epidemics and pandemics. So basically, how research carried out in the aerospace can actually used to face epidemics and pandemics. When you think about, space, you know that we have to face a lot of stress, and it is a difficult situation. There are risks because you have to adapt your body. Because when you go to Mars, for example, there is no gravity, and you might also be contaminated by bacteria or viruses.
inizio piano abbiamo considerato tre scenari,
We
che sono
considered three
settimanali,
scenarios.
settimanalmente nelle ospedali. Delle persone che
We
sono
first looked at healthcare workers, patients, so contaminated people, infected people, and we also looked at us, so people quarantined. So these types of simulations are carried out to look at the possibility of doing some training and to also use technologies, and also considering the missions carried out in the International Space Station. When it comes to medicine, if you look at medical difficulties, well, there might be some differences and some similarities. I'm not sure you can see this slide, but, well, when you are in the space, there are no medical resources. If you have it, it's because you do it yourself. And this is something, that happens in Mars. For example, you don't have food or drinking water. And so there are some events which are actually considered as very similar to epidemics. And so the missions to the space can have features very similar to pandemics. In particular, the healthcare staff and healthcare workers have to face similar situations to ourselves when they go to a mission to the space. So this means that there are some similarities or compatibility. And if we look at the situation on Earth, but well, of course, there are, for example, the situations of families who have to stay at home, so there are some limitations to be considered. And when we simulate our missions on Earth, well, it could be stopped early because there is an emergency. However, when we do that on Earth, well, we realize that sometimes quarantine has to be prolonged or shortened. But the main difference is that bringing, innovation from the space to the Earth, well, it means that you have to look at what happens to a group of individuals, and then you transfer it to the whole population of a country, for example. I participated in 8 missions, and I personally bought some 3D printed surgical instruments, and they were made to support and help people in self-isolation. These tests were carried out a few years ago. The technology had already been acquired. These are not used for clinical cases. So personally, I did that on dummies. But as I said, I'm an engineer and not a surgeon. I'm not a physician. But there are a lot of studies, established studies. For example, what I'm talking about is a project that dates back to 2 years. And what I'm doing right now is actually reaching out to decision makers to say that they have to look at the space at a resource and exploit our knowledge. For example, the 3D printed respirators were used during our missions, and also there are some strategies which can be adopted on Earth. For example, when it comes to the stress or fatigue containment protocols, which are adopted during our missions, can be applied to the healthcare workers. So the healthcare workers could look at aerospace medicine and the protocols applied there, because aerospace medicine is not done for the sake of research. All the protocols can be implemented and can be applied on Earth, can support healthcare workers, for example, during an epidemic or pandemic. When it comes to telemedicine and how to treat disease remotely and how to communicate to patients, well, these are protocols that we do have, and we can use them to educate patients and users in order to make sure people stay at home. And so we could use telehealth. But there are also lots of other measures that could be used for sterilization in order to limit contamination by viruses and bacteria. So I really want to make you understand that space is a resource to be exploited, because what we do is done for the life and the quality of life of people. We do strongly believe that this research and studies are really useful for us for to face situations like the one we are facing today. The project that you have presented is fascinating. We couldn't see the slides, but we will meet you again during the next festival. I would like to thank Italy for the excellent work, and I would like to thank your team for inviting me. Thank you so much. Thank you, Ilaria. Thank you.